Tawni Peterson, nurse practitioner at Adams County Health Center.
And I'm Rio Peterson, a registered nurse.
For today's live feed, we are going to discuss transmission of COVID-19. We're going to talk about how you contract it, how it spreads, social distancing, and how social distancing takes the pressure off the healthcare system and saves lives. So to begin with transmission, how is COVID-19 transmitted? COVID-19 is transmitted through respiratory droplets. And what that means is if somebody coughs or sneezes and you are under 6 feet away from them, you run the risk of contracting the virus. Additionally, if someone coughs or sneezes and these droplets land on a hard surface, they have the ability to live up to 9 days. So if you come along and you touch that surface and then you touch a mucous membrane such as your eyes, nose, or mouth, you again run the risk of contracting the virus.
So once a person is infected, there is a period of time where people do not show symptoms. This is called the incubation period. The COVID has a long incubation period of up to 14 days. Now, on average, people are showing symptoms at day 5. The concerning part about this is that in that time frame before being symptomatic, people will be in their community spreading the virus onto surfaces where someone can come along and then contract it. It's also concerning because 80% of people that are infected with COVID only show mild symptoms where they may feel well enough to go about their daily routines in the community, further spreading the disease. So let's talk about social distancing. The meaning of social distancing is staying away from others and keeping yourself from contaminating public surfaces as well as coming into contact with contaminated surfaces.
So when people call the clinic and they say to us, is it good enough if I just stay away from people that aren't feeling well? And the answer to that is no, because we don't know who is actually infected and we don't know what surfaces have been contaminated. So examples of social distancing would be stay home as much as possible, avoid air travel, avoid shopping trips, and avoid social interactions. The CDC is actually asking people right now to avoid all social interactions. We need to stay 6 feet apart from anyone that's not in our home. And another question that we get is, what about these essential trips? What if I have to go to the grocery store? Well, the grocery store is considered an essential trip. And so in those situations, you just have to use safety and common sense. You would go to a grocery store when it is the least populated. You know, is that early in the morning? Is that late at night? When you go into the grocery store, either take with you bleach wipes or grab them. Now most all grocery stores have them right at the entry, and you need to wipe down that shopping cart handle. Don't just mildly wipe over it. Scrub that handle down. When you're going through the aisles, be very cautious that you're always at least 6 feet apart from any individual, and be very careful about touching too many items. Once you leave the shopping center, again, wipe your hands down, and when you get in your automobile, wipe it down, wipe your steering wheel down. When you get home, go in and wash your hands. Put your groceries away and again, wash your hands. An area that would be considered like non-essential would be taking your kids to the park. It's not that we don't encourage getting outside. Getting outside is fine as long as you can stay 6 to 10 feet away from people. If you go to the park and you allow your child to get on a swing, you really have no guarantee that swing is not contaminated. So during social distancing, you have to be very diligent to keep your distance from people and keep yourself from touching possibly contaminated areas.
So what is the benefit of social distancing? Social distancing helps to flatten the curve. You've probably heard about social distancing, but we'll talk about what that means. So the curve refers to the number of people infected over a span of time. Without social distancing, there's going to be a rapid rate of transmission through communities, and therefore many people will be infected at once. This reflects a sharp, tall spike in the curve. So by flattening the curve through social distancing, we can slow the rate of transmission in communities, and that reduces the number of people who are infected during the same time period, which means that a large number of people are going to need medical treatment at once. If we have a large number of people that are infected at the same time, we're going to overgo the capacity of our healthcare system to provide care for all those people. So in this case, people are going to show up to the hospital for care, and there won't be a bed available. And that doesn't apply just to people with coronavirus. That goes for people who have been in motor vehicle accidents or had a stroke or a heart attack or any other reason someone might need to present to the hospital.
Social distancing is a community effort that requires everyone's participation, and we urge you to partake in this recommendation right now. If you want more information on COVID-19, check out the ACHC website. The address is achcid.org, and on our website we have CDC links, we have learning tools and resources for our patients. I'm going to say one more time, I want to answer a question that people do present to us, and that is your clinic open? And the answer is absolutely yes. We are taking every precaution that we can to keep our employees and our community safe. We feel very strongly that we need to continue providing care to Adams County and surrounding areas. We are doing everything that we can to lessen the burden of our local hospitals. At our clinic right now, we have Sue, Amy, and Beth are staffing the clinic. Our laboratory is open, our pharmacy is open, our optometry and dental are taking urgent care patients. A lot of our patients are being screened in the parking lot. All of our patients are being screened in the parking lot. Many of them are actually being seen in the parking lot. I know that sounds odd, but it's working very well. If it's deemed necessary, we can bring a patient into the clinic. I personally right now I'm working from home, I'm working virtually. That allows me to see my patients and patients of ACHC through telemedicine. I can provide a visit through phone or through video, through your computer. This definitely encourages social distancing so that you can stay in your home and still receive medical care. So what works best for you is good for the providers at Adams County Health Center. What we really would like for you to do is call ACHC at 208-253-4242, and you can talk to an office staff member and decide what would be the best option for you.
Below the video, there are links provided where you can look at articles from the Idaho Statesman that detail how many hospital beds are available in Idaho, how many cases our state officials project that we see of COVID-19, and how flattening the curve helps to relieve pressure off of the healthcare system here in Idaho. So thank you guys for tuning in. In the comments section, feel free to ask any questions or voice your opinion. Thank you guys.
And one last thing, I would like to say that our next live feed will be on truths and myths when it comes to disinfecting your home. Thank you and have a good day.